Hi, welcome to Healing Matters. I am Pastor Diandra Williams, your host. Today we have our first guest, yes, our first guest ever, Dr. Karmala Chan. Please turn on your notifications and subscribe to this video and for future videos. So again, we have our first guest. This is such a special episode, Dr. Karmala Chan with us. She is out of New York, New York. She is the assisting attending physician at Memorial Sloan Kettering Cancer Center in New York, New York. Thank you, Dr. Karmala Chan, for being on the show today.
Thanks for having me, Diandra.
Of course, we have a lot of history together. I was your patient years ago when you was practicing here in Rhode Island. And I thank you for just taking care of me and, other patients that you serve. And so I wanted to talk to you today about a few things concerning autoimmune disease and chronic illness. When I first met you over 4 years ago, my case was really difficult. I didn't present traditionally with rheumatoid arthritis and dermatomyositis. What made you decide to take on my case?
Um, how, how do you turn a case away? You were sick, you'd been sick for a while, you'd been to several different doctors, you needed help, and the physician that referred you to me needed help figuring out what was going on, right? So it's our job to do what we can. Um, yeah.
Absolutely.
I probably felt that your case was challenging, and I didn't want to fail you. I didn't want to disappoint you. I really wanted to try to get to the bottom of things with you.
Yeah, and I think over time, us communicating and trying to figure things out did help us get to a great end result. What advice would you give doctors and patients that present a little bit different because they might be a person of color?
Um, I think so for you, I think what was helpful is that you took pictures and that you shared pictures with me of what you looked like before and when I met you, and there was a clear difference that sometimes isn't very obvious. So that was helpful. Um, Also, I think staying curious, right? Staying inquisitive, and if things don't quite fit, you want to continue asking questions and probing. Yeah.
So would you say journaling and documenting changes in the patient's body, different environmental changes, do you think those would be helpful things to help bring to the doctors?
Yes, I think if patients, doctors are always looking for a story. So if the patient has a really good narrative or a good idea of how things progressed for them, that is a huge help for us.
Okay.
Uh, yeah.
Okay. So how would you tell a patient for the first visit going to a rheumatologist, what would you tell the top 10 things, maybe 10 things to prepare for that first visit? What are the key things a patient should prepare for?
10 things.
Well, maybe not 10, but what are the key things they should prepare for the first visit?
Um, so I think as a doctor, first of all, I'm always um, looking for a story. I want to know how things started, how things progressed, um, what have you as a patient done to try to change your symptoms? How have your symptoms responded to those things that you did? That kind of that story is very important. The timing of your symptoms matters, etc. The quality of your symptoms, etc. It's always useful to come prepared with a list of your medications. So very frequently patients don't know what medications they're on, and it's a scramble to try to figure that out. So it's help if you've lined up your pill bottles and copied the names down on a piece of paper. That's helpful. You know, getting a good family history is important, and so talking to your family, talking to your parents about what conditions they have, that's helpful. And yeah, if there's anything visible, if there's anything to be seen, if there's a symptom that comes and goes, then photographic evidence is helpful. In this day and age, it's easy to take your smartphone and just take a picture of your swollen ankle. If it's, very often patients will say by the time they get to the doctor, the problem is gone, right? So, yeah.
So you mentioned prescription drugs. Should a patient also jot down any vitamins, any supplements that they're taking as well?
Yes, absolutely.
Now, do those things tend to interfere with medications sometimes?
Sometimes, yes. So it's important to ask your doctor about specific supplements.
Okay. Okay. Now, is there anything that a patient can do? One of our viewers has a question. Is there anything a patient could do at home to help the inflammation subside? Is there any home remedies or things that you could recommend that they could do in between visits?
So simple things like ice. Ice helps make swelling subside. If the problem isn't so much swelling but pain, then sometimes heat can be more comforting than ice. It's always a good idea to stay healthy, live a healthy lifestyle. For example, we know that smoking can cause or is a risk factor that predisposes people to getting rheumatoid arthritis. So if stay healthy, don't smoke. I get a lot of questions about diet. Unfortunately, it's not really clear. Diet is very hard to pin down. It's very hard to study in a very systematic way if dietary changes really make a difference for inflammation. But if you eat a healthy, well-balanced diet where you do things in moderation, you don't overeat sugar or alcohol, then I think that's all good. Yeah.
Okay. So one of our viewer questions was actually about diet. Can diet contribute to inflammation?
There are certain conditions. So for example, if you have celiac disease, which is an autoimmune condition that affects the gut, then gluten can make that worse. Having gluten can make that worse. Apart from that, like I said, it's not clear. There aren't very clear-cut associations between diet and inflammation.
Okay. And now I have another question.
Yeah.
Why do you believe women are more affected with autoimmune disease than men?
So we don't really know the answer to this question. It may have something to do with hormones, having estrogen and progesterone, estrogen particularly. It may also have something to do with the X chromosome, which women have 2 copies of and men only have 1 copy of. But we don't really actually know this for sure. We know it to be true, but we're not we haven't figured out why yet.
Okay. Now, you mentioned earlier about jotting down family history. Now, is there a connection with maybe a mom has a disease and that her children might have it? Or is there a direct connection with that?
Yes, if there is a so having a family history of autoimmune disease is a risk factor for the patient themselves having an autoimmune disease as well. Yeah.
Now, would those diseases be the same, or would it just be something that um, a child might get, or they might get a different variation?
Either way.
Either way, okay, okay, that's good to know because sometimes until you get sick with chronic illness or autoimmune disease, you don't know your family history. So that's a good thing to know, especially if you're childbearing age and want to have children or continue your uh, having children.
Right. I
That's a
don't remember if you had, did you have a family history? I don't remember.
I found out later that I did. I did
Uh-huh.
on my dad's side.
Mm-hmm.
There were cousins that had autoimmune disease and chronic illness.
Mm-hmm.
Um, and so being diagnosed properly did help me to do my research with my family members and also to have a conversation with my children, the possibilities.
Mm-hmm.
So I found it to be helpful. And anyone watching, I hope that they do the same to have that conversation about, medical history, not only about autoimmune disease and chronic illness, but just to know, what types of things run in your family.
Yeah. Even things like diabetes is sometimes autoimmune, thyroid disease is sometimes autoimmune. So knowing all of that helps.
Right. Now, there is a large percentage of African American people that suffer with autoimmune disease. Do you know why there's a greater number of African Americans that suffer versus other cultures?
We don't know the answer to that either.
I know
It's
autoimmune disease is
true.
such a mystery.
It's yes, yes, yes. It is very, so much of what we do is still uncertain. There's a lot of uncertainty in our field for sure. Um, yeah.
Do you think environment is a factor? And what I mean by that is um, not just where they're located locally, but their personal environment. Do you think autoimmune disease can be brought on suddenly by their environment?
That has not been proven. Um, there are some diseases with some associations with things like viral illnesses, for example. Um, there's after the 9/11 incident happened, there are people that were working down there at the World Trade Center kind of have ended up having a mix of autoimmune conditions. Anyway, so there's a lot of, let's say, interesting possible relationships between environmental factors and disease. I can't say that they are extremely well studied and well established.
Do you think if they study these cases more, there would be a connection between environment and, what people are suddenly hit with?
Hmm. I think it's getting an autoimmune disease is probably related to both your genetic makeup
Okay.
and to some degree your environment.
Okay.
How much does the environment contribute to that? Or conversely, how much does the genetic makeup contribute to that? I don't think it's clear. Let me just say though, so for example, going back to the smoking example, that is a clear association. Smoking is absolutely a risk factor for getting rheumatoid arthritis. So,
Right.
so yes, there are some instances where the relationship is clear, but yeah, it's not entirely um, established.
Okay. Is there any test that you can recommend a patient asks their doctor to run to help them to get a proper diagnosis for maybe lupus, RA, fibromyalgia?
Well, what your doctor decides to check for really depends on what they're looking for. Like they have to, if they're taking in your symptoms, listening to your story, doing a good physical exam, um, then they will come up with a list of possibilities to explain your symptoms and your findings. And then they order tests based on what they're looking for, based on what they think they're going to find. Um, so there isn't, I can't necessarily prescribe any particular list of tests. I think it all depends on what the physician thinks is going on. The most important thing, I suppose, is that the physician has that they keep these diseases in the back of their minds as a possibility, because if they don't think about it, they're not going to look for it, right? So
Absolutely.
so they have to kind of be aware of what the conditions are, um, and be aware of the possibilities, be open to the possibilities. Yeah.
Yeah, I ask because oftentimes, as we know, um, sometimes certain diseases mimic others. So it might look like it's fibromyalgia, but it's really something else.
Right.
And so sometimes what you think you have, you don't. And the other thing, which we've found out in my case, you can get one diagnosis and then a few months later get another diagnosis. I feel like, unfortunately, um, autoimmune disease travels in packs. Um,
Yes, it
yeah,
does.
it's a weird thing, and so sometimes the diagnosis ends up getting changed or other things get added to. um, and can you speak on that, why usually or sometimes autoimmune disease comes in ones and twos and threes, and it's just
Yeah, there is definitely a genetic predisposition to it. That's why. And so you already have the genetic makeup that, um, so what is an autoimmune disease, right? It's your body, your immune system,
Mhm.
instead of being able to recognize your own cells versus foreign cells, your immune system thinks of your own cells as foreign. And so anyway, so you have the genetic predisposition for your immune system to behave this way, then it's easier then for the immune system to behave this way against multiple different targets. So you can have antibodies to your thyroid, and you can have antibodies to your skin, for example, or your liver, or so it goes back to that genetic predisposition, and that's why it is often that someone who has one autoimmune disease will end up having more than just one.
Yeah, yeah, and that having more than just one is a juggle. It is really hard to balance the medication that comes along with multiple autoimmune diseases.
Yeah.
Um, And sometimes, can you speak on the emotional component that comes along with autoimmune disease? Can you speak on those symptoms and how someone can kind of manage that?
Did you have a lot of emotional
I did. I did.
Yeah.
I had a lot of emotional ups and downs, did battle with depression, just because, like I said earlier, the diagnosis changed. And along with the diagnosis changing, the medication changed. And we found out along the way that a lot of pill forms didn't work for me, that I needed injectables. And so that did play a lot um, on my emotions, constantly um, getting blood work, constantly getting tests, constantly going for scans and medicine changing. And it is very depressing. It can be very challenging for a patient. Um,
Yeah, absolutely. You can't, and at the time you had a full-time job
I
and you
did.
were trying to keep that job
Yeah.
while trying to get better.
Hmm.
It's all I can say is, first of all, it's helpful to recognize that you need help,
Yes.
that asking, there is no shame in asking for help from your family or your friends or your physicians. um, that's probably the most important thing. And I think very often women are, so first of all, as we talked about, autoimmune disease is more common in women, but it's the women that take care of the kids and take care of the household and all that. And so it's I find that it's hard for women to ask for help because they think they're the ones that need to be strong and keep the home
Absolutely.
intact.
Absolutely.
So having a good support system is important. And I think for you, your church did a lot of that for you as well, right?
Yes.
um, and that may not be true for everyone, but
Mhm.
if you have that to lean on, that's something absolutely helpful. um, I think therapy can be helpful, and medications for mental health issues can be, no question, can be helpful, because how you are doing mentally will also impact your physical health and
Ab-
vice versa.
Absolutely.
Yeah.
And I've found that to be true for me. Um, the better things were in life and the better I felt, the better I felt mentally, and vice versa. And I know with having um, a good support system, a good therapist, um, you as a doctor and other doctors on board, it all worked and helped me to get to a place of balance.
Mm,
I think that is the goal of a lot of people um, that are newly diagnosed. They know that they might not get back to their old self, but they're trying to find a balance between where they are and where they want to be.
yeah.
And being emotionally sound is key. It's really key. And um,
Yeah.
I think, like you said, there's no shame in getting mental health. There's no shame in that. Um, and in fact, I think the better we are emotionally as people, whether you're sick or not, the better we treat ourselves and other people. Um, and so I just want to
Absolutely.
speak on that part because I think sometimes that people suffer in silence because they don't know what to say or how to say, or if uh, they feel like they might be going crazy. Like, is this part of the disease? And I know that the first couple of doctors that I saw didn't speak on that component about the depression and things that would come along uh,
Mm,
with autoimmune disease.
mm. And the other piece of it too, I think, is that these are not diseases that have any, sometimes, often, there are no outward signs that you're sick.
Yeah.
So, people on the outside, people who are not in your circle don't know how much you're going through. And that can be hard. That can, how do you let them know that you need help when it doesn't look like you need help?
Absolutely. Absolutely. That is definitely my story. Um, that happened, but I'm glad that I was able to share with my family and my community what I was going through and where I'm at now. I'm in such a great place. And it's because of everybody's support, like I said. And I thank you, Dr. Chan, for being a part of that foundation to get me where I am now. And
You made it so easy to care for you.
oh, thank you, thank you, thank you. You're a great doctor, as you know. You're a great doctor. And so I want to thank you for your care. I want to thank you for being on Healing Matters and being my first official guest. So awesome. So awesome. Is there anything before we wrap up you would like to say to the audience?
I think I think, finding the right doctor it can be tricky, right? You're not going to always like all of your doctors all the time,
Yes.
but you have to have a relationship with someone that you can trust and that is looking out for you. That's the most important. Someone you can have dialogue with about your symptoms, your treatments. Because if you don't have a trusting relationship with a doctor, it's not going to work. You're not going to get better.
So thank you, Dr. Chan, for being on the show today. We appreciate you for being on Healing Matters. If anybody wants to reach out to you, can you please tell us where they can reach you at?
Sure. My office phone number is 212-774-7548. I am a practicing rheumatologist at the Hospital for Special Surgery in New York City.
All right. Thank you so much for sharing that. And hopefully people that have questions or are looking for a physician in your area will reach out to you. And so thank you to the Healing Matters viewers for watching. We hope this encouraged you. Remember, your healing matters.